100 mark. That's good news. All right, the Senate is trying to work out a compromise on a health care bill. President Barack Obama expected to meet with Democratic senators today to discuss that issue. Democrats are taking a stronger position on health care legislation. They now say that they will push through legislation even if negotiations with Republicans don't work out. But making major changes to health care is costly, of course, and confusing, to say the least. Here to try to sort things out a little bit, U.S. Congressman Brian Bilbray. He joins us now representing California's 50th District. Congressman, thanks for joining us, first of all. What is the most confusing thing here? And what got me a little bit is that we've kind of seen a change in the shift of what we're addressing, health care reform to now health insurance reform. That's recent.
Yeah, well, you've got to, we can get into all this, but the fact is, there's one thing about coverage, the other is access to health care. But really, what's going on is there's about 4 or 5 different proposals that we know of, and now, because they finally really couldn't get a consensus to shove something through quickly before the August break, now they're going to put something together, and hopefully what they do is get those committees together, have something that the public and Congress can read before they ask for a vote. And that's one of the scary things we've seen the last couple of months is always this attitude of, well, don't expect to vote on it. You just vote yes and trust us, and that's where we end up with things like the AIG pay raises when people say, my God. I mean, Bob Filner was talking about, he couldn't believe the kind of things that were jammed into bills, but when you're not even allowed to read the bills, when they don't even have the bills all printed up.
Which is almost reminiscent a little bit when the stimulus package was voted on. A lot of people just kind of voted on it without reading it.
And the so-called climate bill, 300 out of 1,300 pages weren't even included, and you knew it was there, but they said we don't have time to integrate it and just vote on it.
Now, I don't want to call it dissension in the ranks, but President Obama actually came out a little bit against Tim Geithner and some of the guys saying that maybe we're going to have to raise taxes here to figure out this whole health care cost thing. Are they kind of going back and forth with the mixed messages they're sending out to people about whether or not we're going to need to raise taxes, but then that would be going back on the president's promise?
Yeah, the president has painted himself in a corner on campaigns. That's a tough thing that politicians always do. But I think the key here is that there was a promise that we could get 3/4 of the cost of any new health care program out of waste, fraud, and abuse. A lot of us are asking, then why aren't we working at that first? Prove to the American people we can be trusted to address waste, fraud, and abuse, and then let's talk about how we're going to spend that money after we save it, not spend it before we save it.
Socializing health care is a term a lot of people that are opposed to this have been throwing out there. What's your take on it? Is this a form of socialist health care, if you will, or not?
Look, there's some people that are up front and really open about this, and I think you should commend somebody like Bob Filner, who's saying, look, I want a single payer, I want socialized medicine. Bob's great about that. He doesn't kind of hide behind a bunch of nuances. Then there are those that do use other terminologies, but you know from their the president pretty well would like to follow Bob's agenda on that issue. But then you have those that are kind of easing into this on the backside. And then you got this whole issue that most people aren't talking about right now. The next big crisis in healthcare isn't do you get insurance, it's do you get a doctor that will provide it. And we're right now...
And who's going to pick it and how are you going to select it and all that?
Will they be working? In the next 10 years, you've got people my age that are retiring and there's no doctors being trained to come replace them.
Interested in how the insurance industry is reacting to all of this, because I know that they were kind of playing along for a certain, but up until what point would they actually kind of play along with this whole reform?
Oh, they'll play along as long as they can get a pound of flesh out of it. The ones missing out of this are the trial lawyers and the tort issue, because that, when I was a county supervisor here with, the health care that we provided here, tort, exposure is a huge issue of procedures and things that are being done, not because it's good for your health, but covering in case you get sued. That's the whole something that no one's even talking about.
So much to talk about. We need like 10 segments on this.
Absolutely.
Congressman, I know you go back on September 7th. What's first on the agenda when you get back in?
Well, we hope that they have printed up a bill that we can read before we have to vote on it, but we've got a lot of that kind of stuff. We have a lot of the controversies going on down in Central America. We obviously got what's going on with the wars back in the Middle East, and then we've got the war at the border that we just had a terrible murder going on. That's a whole new issue that we're going to have to address.
And we know you were at the memorial as well for Robert Rosas, the Border Patrol agent. All right, Congressman, thanks for joining us this morning.
Thank you very much.
Busy man. All right, Charlie.
All right, thanks so much.